Muscle Doctor, hi, it's Liam here, and in this shorter series of anatomy, we're going to be taking a focused look at the different muscles of the human body with a focus on origins, insertions, and actions in the muscles that we need to know in more detail. So we're going to start with the superficial compartment of the posterior lower leg, the calf. It's quite a wordy way of saying it, and we're going to begin with the most superficial part of that, which is the gastrocnemius. So gastrocnemius, where does it get its name? Gastro, belly. It's got two bellies, and knie or kneem, Latin for leg. Also sounds a bit like knee, which is knee, or how it's spelled. So one way of remembering that. Gastrocnemius is a biaxial muscle, so it crosses two joints, which means it's powerful, it's more prone to injury. We've got the origin, which is always going to be closer to the axial skeleton. Axial skeleton meaning the core, appendicular skeleton meaning the peripheral limbs. And that origin would be the posterior condyles of the femur. So the femoral condyles, we get rid of everything, these two bony bits down here. And it's the posterior surfaces of those. So we add some layers back on, we highlight the muscles, and then we remove everything else. What does that tell us? Well, it tells us that it crosses the knee, so it must act on the knee. If it's posterior, it's going to flex the knee. How does it flex the knee? Because if we try to contract our gastrocnemius, it usually plantar flexes the ankle, which is its other action. Well, it's only really going to efficiently flex the knee with the ankle in dorsiflexion, so that distal end of the Achilles or calcaneal tendon under tension. So that would then give you your origin and insertion. It inserts into the calcaneus via the calcaneal tendon. And that would be, looks weird without an Achilles. Down this end here. If we zoom in, we can see that. So we've got three muscles there. That would be the first one, the most obvious, the most superficial, the one that you can see when you look at the back of someone's leg. If we remove that, then we've got number two of three muscles in the superficial compartment of the posterior lower leg. It's catchy, and it's Soleus. So Soleus, meaning sandal in Latin, because it looks just like a sandal. That does not cross the knee. So this is why we've got two fairly big muscles there. There would be no duplications. There's always reason and logic to why the muscles are there. And the reason for this is that we've got a separate muscle here that does not cross the knee. So the origins for this, they are numerous. Let's multi-select before we remove everything else. We can show you the bone and the muscle. So the origin, the first one, is going to be the soleal line, which you can see the mouse there, the cursor on the screen, is that bit just there. This is the soleal line of the tibia. It's just a common bony prominence, a part of the posterior proximal tibia that a few muscles insert from. So you've got flexor digitorum longus, popliteus, but then we've also got soleus just there as well. We've got the proximal posterior surface of tibia, PPST. Sounds like some kind of disease. And then posterior aspect of the head of the fibula. If you're struggling, just remember top of the back of the lower leg bones. So that's where it comes from. And where does it go to? It goes to that calcaneus. Again, via the calcaneal tendon. How does that work? Well, if we add the layers back on, I'm not sure how faithful this app is to human anatomy in this sense, because it looks like a separate tendon, but actually the two share fascial connections and kind of become one, really. Although soleus does sit underneath gastrocnemius. So that will be two. What's the third muscle? Well, the third muscle that we've got is plantaris. Have you ever heard of plantaris? If you're into anatomy, you may have done. Oops, blinking, it's gone. Plantaris, just there. So look at this weird fella, the poor little thing. Some believe that we have evolved out of the need for this muscle, which is why it just looks so ridiculous. You've got this tiny, quite sizable, but still relatively small muscle belly up here in the popliteal space onto the lateral posterior femoral condyle, back of the outside of the femur at the bottom. Crosses the knee so it flexes it. And then you've got this big long tendon that goes from lateral side femur all the way down, wraps around the medial side of soleus, and then just onto the top of the calcaneus as well. So these three muscles together, they make up that superficial compartment, but we also call those triceps surae, which means the three heads of the calf. And the actions of plantaris, it shares the same as gastroc, although much, much weaker. Crosses the ankle, crosses the knee. It's going to act on both. It's at the back, flexes the knee, and plantar flexes the ankle.